Now let's discuss the Now, first of all, what are anticoagulants? So, anticoagulants are also called blood thinners, which are used to prevent the formation of blood clots. Normally, they interfere with the natural blood clotting process, and these anticoagulants are working through two cascades, intrinsic pathway and extrinsic pathway, which we discuss further in the mechanism of action. So, now let's discuss the mechanism of action. Talking about the mechanism of anticoagulants, it involves the intrinsic pathway and extrinsic pathway cascades. These both act collectively to prevent the blood clotting, but the main four steps involved in the mechanism are inhibition of clotting factors, direct thrombin inhibition, factor 10A inhibition, platelet aggregation inhibition. So first of all, inhibition of clotting factors such as warfarin inhibit clotting factors production by interfering with vitamin K. This reduces the levels of clotting factors second, 7th, 9th and 10th, which slowing down the blood clotting process. Next is the direct thrombin inhibition. So dabigatran is an anticoagulant which directly blocks thrombin, a key enzyme in the clotting cascade. This prevents the conversion of fibrinogen into fibrin, which is a vital step in the blood clot formation. Third is the factor 10A inhibition. So anticoagulants such as abixabin, which targeting factor 10A directly inhibiting this enzyme, which plays a pivotal role in clotting cascade. So by inhibiting factor 10A, these drugs reduce the generation of thrombin, thus slowing down or preventing clot formation. The last but not least is the platelet aggregation inhibition. So aspirin is one of the most important drug which inhibits the platelet aggregation. So they block the action of platelets and reducing their ability to stick together and form clots in the blood vessels. So these all are the steps which plays an indispensable role in preventing blood clot. Now let's talking about the pharmacokinetics of the anticoagulants, which involves four steps: absorption, distribution, metabolism and excretion. Absorption: anticoagulants are well absorbed when taken orally except for the heparin, which is not administered orally. Second is the distribution: anticoagulants circulate in the bloodstream and some are highly protein bounded. Anticoagulants metabolism varies but often involves the liver, and in some cases it involves the kidney for the metabolism. Excretion: they are primarily eliminated through the renal excretion except for the heparin, which is cleared through the hepatic metabolism and renal excretion. Next. Now, what are the indications of the anticoagulant drugs? So there are many indications when we prescribe anticoagulants. Physician prescribe anticoagulants to patients. So some of the conditions are arterial fibrillation, deep vein thrombosis, pulmonary embolism, venous thromboembolism, mechanical heart valves, stroke prevention in the high-risk patients, acute coronary syndrome, hypercoagulate states, post-surgical prophylaxis, catheter-related thrombosis. In all conditions, the anticoagulants work by preventing the preventing the blood clot, or by preventing the platelet aggregation, which could be a risk for blood clotting. So now let's discuss about the rationale of use of anticoagulants in different populations. First of all, we are talking about the pediatric population. In pediatric population, anticoagulants may be used in the children with conditions like congenital heart disease, certain genetic disorders, or pediatric surgeries, where there is an increased risk of blood clot formation. So the choice of anticoagulant and dosing must be carefully adjusted for the child according to their age and their weight. And if we're talking about the adults, anticoagulants are commonly prescribed to adults, prevent and treat conditions such as deep vein thrombosis, arterial fibrillation, and following any orthopedic surgeries to prevent clot formation. So in adults, the goal is to reduce the risk of stroke, pulmonary embolism, and other clot-related disorders. So moving further to the older adults, they may be more susceptible to the blood clot formation due to their age-related changes in the circulatory system. Anticoagulants are used to manage conditions like atrial fibrillation, deep vein thrombosis, pulmonary embolism, and the close monitoring is the main goal in older adults due to their age-related factors and comorbidities. And the last population which we consider is the pregnant women. So pregnant women may develop conditions like deep vein thrombosis that can increase the risk of blood clots. So anticoagulants such as heparin may be prescribed during pregnancy to prevent or manage these conditions while managing the potential risks to the fetus. Let's discuss rationale of use of anticoagulants in different diseases. So first of all, talking about the atrial fibrillation and stroke prevention. So in these diseases, anticoagulants like warfarin or other anticoagulants, they are prescribed to patients with atrial fibrillation to prevent blood clots in atria, which reducing the risk of stroke and systemic embolism in deep vein thrombosis and pulmonary embolism. These are used to treat and prevent clot propagation or embolization. In acute coronary syndrome, anticoagulants along with antiplatelet agents are given to patients with acute coronary syndrome to prevent further clot formation in coronary arteries, which reduces the risk of myocardial infarction and other cardiac events. The another is venous thromboembolism in cancer patients. So cancer patients are at high risk of venous thromboembolism. So anticoagulants, often low molecular weight heparin, are used both for the treatment and prevention of venous thromboembolism in this population. Next is the mechanical heart valve replacement. So these can trigger the clot formation due to their artificial surfaces. So patients with these valves require long-term anticoagulation with drugs like warfarin to prevent clot-related problems. Next is antiphospholipid syndrome. So this is autoimmune disorder which increases the risk of blood clots, including deep vein thrombosis and stroke. So anticoagulants are used to prevent and manage these type of clots in patients with antiphospholipid syndrome. Now talking about the side effects of anticoagulants, which are mainly include bleeding because they prevent the blood clot, but the side effect turns to be the excessive bleeding. Second is the heparin-induced thrombocytopenia, and some people may also suffer from the allergic reactions. Osteoporosis, skin necrosis are the evident side effects. Other than that, gastrointestinal distress, hair loss, and hemorrhage during the procedures are the important side effects of anticoagulants. Now we are talking about the toxicity. So if toxicity of anticoagulant occurs, the most common symptoms are uncontrollable bleeding. The second one is intracranial hemorrhage if they cross the blood-brain barrier. And third one is the blood in urine or dark or tarry stools. And the last, the signs of anemia occurs in the patient who have a toxicity of anticoagulants. So next, talking about the treatment of toxicity. So if toxicity occurs, first of all, stop the anticoagulant immediately. Secondly, seek the medical attention to prevent the life-threatening situations. Thirdly, vitamin K is an antidote for the warfarin toxicity. It helps to reverse the anticoagulant effect over the time. And next is protamine sulfate, which is also an antidote for the heparin and can partially reverse the anticoagulant effect. It is particularly useful for unfractioned heparin and may have some effectiveness against the low molecular weight heparin. And the last is fresh frozen plasma. Fresh frozen plasma can be used in case of severe bleeding associated with warfarin or other vitamin K antagonist. It contains clotting factors that can help to correct the coagulation abnormalities. Next is the clinical judgment model, which plays an imperative role in clinical decision making process for the nurse role, what to do after or what to do before the administration of drug. These include 6 steps. First step is recognizing cues, which involve, this is the initial stage of the cycle where healthcare professional such as nurse collects data and observe cues from the patient. These cues can be objective or subjective. The next stage is analyzing. In this phase, nurse analyze the gathered information. They consider the patient's medical history, signs, symptoms, risk factors. They may use tools like medical guidelines, protocols, and their clinical knowledge to identify the potential issues. And the third step is generating hypotheses. Based on the analysis, healthcare professionals generate one or more hypotheses or possible explanations for the patient condition. These hypotheses can educated guesses about the underlying problem. Third is the solutions. So after formulating hypotheses, the healthcare professional consider the alternative solutions or interventions, which includes diagnostic tests, further treatment and assessments. And next step is taking action. When we finally take all the planning into the action and implement all the planned steps. And the last is the evaluation, when we evaluate the effectiveness of our plan. This clinical judgment model is used to identify the underlying problem. For example, if we want to know the side effect of a particular drug, if we know about the underlying disease, why we are giving anticoagulants to the patient. So this model plays vital role, and it is a great tool for the healthcare professionals to design their planning, to design their actions for the patient so that they can provide quality care to. Now discussing the role of nurse before administering the anticoagulants. So the first step is patient assessment. So before administering the anticoagulants, nurses conduct a thorough patient assessment, which includes reviewing the patient medical history, current medications, allergies, and any previous experience with the anticoagulants. This assessment helps to identify the potential contraindications, interactions, and patient's overall suitability for the anticoagulant therapy. The next is the lab tests. So nurses are responsible for coordinating and performing necessary lab tests to across the patient's baseline coagulation profile. So tests like INR, PTT, and platelet counts. So these parameters helps to determine the appropriate dosing and assess the patient's response to treatment. Next is patient education. So nurses are instrumental in patient education. So they provide detailed information to patient about the purpose of anticoagulant therapy, potential side effects, importance of adhering to prescribed regimens. So patients are also educated about the sign and symptoms of bleeding and clotting complications and when they have to seek medical attention. Next is informed consent. So nurse ensure the patient or their legal representatives provide informed consent for anticoagulant therapy. Next is antidote availability. So nurses play key role in ensuring that antidotes or reversal agents are readily available. They should be aware of antidotes specific to the type of the anticoagulant being administered. And the last is the communication. So effective communication is essential. Nurses collaborate with healthcare team, including physicians, pharmacists, laboratory staff, to ensure that the anticoagulant therapy is well coordinated. Next is the nurse role after administering the anticoagulants. The first of all is the assessment of vital signs every 2 hourly to check the stability of the patient. Second is the observation of allergic reactions to the drug and immediate side effects to the drug so that we can notify the physician or take any immediate action. And the next step is documentation of each and every event about after the administration of anticoagulants and documenting each dose at proper time before or after ending of the shift. And the last is patient education. So educate the patient about the drugs so that they can complete the drug course. And finish them properly when the course ended, and educate them about the follow-ups and when they need to seek the medical attention.